Now, suicide is the second leading cause of death for teens and young adults in the United States. And to help all of us parents better understand the warning signs and prevention is Dr. Carla Allen from Phoenix Children's Hospital. Thank you so much for coming. I think people might be surprised to hear that statistic, that it's the second leading cause of death. What's happening?
Well, I want to say a couple of different things about that. The second leading cause of death means it's important. We have to pay attention to it. But the likelihood that any one kid is going to die that way is still incredibly rare.
Okay.
And now that we know a little bit more about how to help connect with kids earlier, catch them earlier through screening and good interventions, we can help get them back on a trajectory of health and wellness.
Tell me a little bit about the warning signs. As a parent, oftentimes when something like this happens, it can completely take the entire family off guard and shock them. I didn't even know that my son or my daughter was dealing with this. What are the warning signs that we really need to be on the lookout for?
Well, we want to pay attention to kids who are becoming increasingly isolated. They stop doing the things they love to do. They're not interested in school or hanging out with their friends in the same way. That's a big warning sign for sure. Also, disrupted sleep. And grades that drop, of course. So
yes,
those are the big kind of warning signs.
Grades dropping is a big warning sign. So what's a way that parents can intervene? Because sometimes they almost not scared, but just they want to tread lightly. So what's a good, smart way to talk to my kid if I'm starting to notice some of these signs?
It's important, if you're worried about suicide, to ask directly.
Really?
So, yeah,
okay.
We don't plant seeds in kids' heads by asking. In fact, we demonstrate to them we care, we're open, and we're happy to talk about hard things,
yes,
which normalizes that experience.
Okay, so what would that be? Give me an example. Like, what would that conversation look like?
Well, you know, sometimes I hear that kids are really struggling these days. How are you doing with your mental health? That's a great gatekeeping question, right? And then after that, you know, do you ever have thoughts of wishing you weren't alive anymore, wishing you were dead? I know that's hard, but if you don't ask, you won't know the answer. And then you can't provide the sort of recommendations like, hey, you know, many people struggle with those thoughts from time to time, and we can manage them. Let me talk to you about how I did that when I was your age, or how I'm doing it even now.
Oh, I love that. You guys have so many resources at Phoenix Children's Hospital. This is one of them. Yeah. Tell me a little bit about what you guys can provide to families.
So when your kid 10 or up comes into a clinic for an eye appointment or an ortho appointment, your kid gets screened for suicide risk.
Really?
And we
every time?
Every time.
Interesting.
And we do that because we know it's such a prime time to intervene. Okay. Those kids come for medical care. They don't all have access to a psychologist, right? So when we screen them and we find something that they need help with, we use this to telehealth into that exam room before they leave, to give resources, to connect them to ongoing evidence-based therapies for suicidality, which is life-saving. We're giving kids the skills they need to lead a healthy life in their childhood.
That's so incredible, because I feel like a lot of times we just brush things off or we put it under the rug, or honestly, getting help is expensive and insurance can be too complicated. And so with everything else that parents are dealing with, they're like, you know what, we're just going to grin and bear it, you know? But this is such a great option that this will just be part of the appointment.
We want to destigmatize mental health. It's no different than physical health. It's just as important to your overall well-being. And so making it convenient for families helps us make a real connection.
So if I might be having trouble like this with my kid at home, what's the first step if I really want to reach out to Phoenix Children's? What should I do?
Your first step is to talk to your pediatrician, who many times in that very office have tremendous resources at their fingertips to help connect you to good care. So start with your pediatrician first, always.
This is a huge problem. Second leading cause of death. When you see some of these kids, is there something that you feel like if every parent just did this, it could help so much?
I think one thing that's really important is to keep your home safe. So by that I mean, you don't need huge Costco bottles of Tylenol and Advil and things that are out that kids can overdose on. You want to store your firearms exceptionally safely when you've got an adolescent, especially with a hot brain in your house. You do that and kids will survive to see another day and their emotions will cool down. Keep your home safe.
Dr. Allen, thank you so much. We love Phoenix Children's over here. We're so thankful for all the work that you guys are doing. All right, let's take